Finasteride is a highly effective medication for combating male pattern baldness, but the potential side effects, especially related to sexual health, are often overstated and exaggerated. You should know the truth. While it's crucial to understand the potential side effects, it really only applies to a small percentage of users, and many individuals experience significant hair growth without any adverse side effects. Have you been avoiding treating your hair loss because of these exaggerations? In this video, I not only tell you the truth behind Finasteride, but other methods to help you treat your hair loss. Also, where did all these rumors come from? In this video, I'll be telling you the truth behind Finasteride. So what is Finasteride and how does it work? About 40 years ago, we discovered that there's a conversion process in your body, and that is testosterone is converted to dihydrotestosterone, and that exerts its effects. Now, they discovered that dihydrotestosterone, and specifically type 2 dihydrotestosterone, has some effects on male body that aren't so great. The first one is that hormone can actually cause your prostate gland to enlarge. That's called benign prostatic hypertrophy. Well, DHT type 2, dihydrotestosterone type 2, also causes men to lose their hair. So you have this hormone that's in your body that is causing two untoward side effects. And there was a drug company, Merck, that decided that if they could do some investigation and figure out, hey, is there a way we can inhibit this conversion of testosterone to dihydrotestosterone, we might be able to treat two medical conditions. And sure enough, they did the research and it showed that this medication, Finasteride, will actually block that conversion again from testosterone to dihydrotestosterone. The trials for this medication indicated that it was very effective in decreasing the benign prostatic hypertrophy, or BPH, but the trials also showed that it was very effective in slowing hair loss and actually improving the quality of hair in many patients. What Finasteride does is it blocks the impact of that DHT on the follicle and changes the growth cycle. So in other words, if a normal growth cycle in a hair that's about to be lost may only be several months or 4 or 5 months, it will elongate that growth process and allow the follicle to grow bigger and grow hair faster. That's how it improves the quality of your hair. Now, what it won't do is if the follicle's gone, there's nothing for the Finasteride to work on. So you have to have hair in the area for there to be any impact. So how effective is Finasteride? Well, it's a little bit of a hard question to answer because everybody has their own idea what effective is to them. It's not uncommon for me to hear patients come in and go, I tried it, but it doesn't work. It was not effective for me. But what they don't realize, even if it doesn't grow hair or improve the quality of the hair, there's close to 100% chance that it's slowing the hair loss process. So when I talk about effectiveness, I want to know, is it growing hair or at least improving the quality of the hair, and is it slowing the hair loss? Slowing the hair loss is half the battle. If I can do that, keep your baldness pattern the same size, it will make it more effective if someone ever decides to have a hair restoration surgery. So I want to know those two factors. Is it slowing the hair loss? Is it helping improve the quality of the hair you have? And Finasteride does both. In terms of improving the quality of the hair, the study shows somewhere about 60-65% of patients will have an improvement in both hair counts and hair diameter. So it is very effective. And again, almost 100% chance it's going to slow your hair loss. So what's the downside of Finasteride? Let's talk about some of the side effects. If I had to pinpoint one thing that patients are concerned about is what they've heard about Finasteride, and that is specifically the sexual side effects. In reality, the studies show there's less than a 2% chance of the dreaded sexual side effects, and those are a lowering of your libido and occasional erectile dysfunction. Now, even in that case, if you're part of that 2% group and if you continue to use the medication, your body gets used to it, and about half the time the side effects go away. So in reality, the side effects after taking it for a month or two might only be 1% for each of those side effects. Now, what if you're part of that 1% group where it doesn't go away? Well, you have some options. First of all, in the clinical trials, anybody that had a side effect within the first several months, once they discontinued the drug, there was 100% of those people, the side effects went away. So obviously I tell my patients, if you have one of those side effects in the first month, stop the drug. Okay, that's as simple as that. Now, there's a group that might develop side effects a little bit later on. Again, that occurs maybe, several percentage points. But in that case, what I tell patients is to decrease the dose. If you cut the dose in half, somewhere around 80% of patients, the side effects will go away. What you're doing is converting less testosterone to dihydrotestosterone, and that may help you gain your sexual function back completely. Now, you might say, well, I don't want to decrease the dose in half. That's not going to help me at all. No, in reality, half the dose is still about 96% as effective as the full dose. It'll allow you to continue taking the medication, slow the hair loss, and enjoy the improvement of your hair. So it's still worthwhile to use. If my patients have side effects at that half dose, I tell them try a quarter of the dose. You might say it's not going to be effective at all, but it actually is about 93% as effective as the full dose. So in general, there's a protocol. If you're experiencing side effects from the finasteride at the full dose, you can go to 50% the dose or 25% of the dose and still have a great effectiveness on your hair loss. A frequent question I get from patients is, what about the long-term effects of being on finasteride? I've been doing hair restoration for about 26 years, and I have patients that have been on finasteride for that length of time. I have not had any patient that experienced a side effect, got off the medication, and didn't have full return of their normal sexual function. The other thing is, we have over 55 million man-years of data on this medication, and there have been no significant long-term side effects reported. Now, what people are hearing about these days is something called post-finasteride syndrome. And what that is that we have a population of patients that have been on finasteride for many, many years, say starting in their mid-20s, they've been on it for 20 years, and then they started to notice that their sexual function isn't what it used to be. They just don't have the desire, their libido's decreasing, or maybe they have occasional erectile dysfunction, so they think, oh my gosh, it's the medication. Well, I have some news for most of the men out there. I hate to tell you this, but when you get into your 40s, guess what? You have an over 40% chance of having occasional erectile dysfunction and a lower libido. So you can't necessarily relate having been on long-term finasteride and say that's the cause, because the way the male matures and ages, that's a natural part of that. If you're interested in using finasteride, you do have to consult a healthcare professional. That's why this is only available with a prescription, because there are some considerations. Finasteride will change the size of a prostate gland, and the prostate gland produces something called PSA, prostate-specific antigen, and that's a marker we use to detect prostate cancer. If you're on finasteride, that will shrink the prostate gland and you will produce less PSA. Now, the reason that you have to see a healthcare professional is that they have to monitor your PSA levels and they have to make an adjustment to the value to make sure everything's okay. The other thing is, you want to make sure you're getting all the information you can about the medication. Because it's only available by prescription, you have to see a healthcare professional. So if you're interested, reach out to a dermatologist, your primary care physician, or a hair restoration specialist to get a prescription for this medication. It's also available online through services such as Hims, Keeps, or Roman. They'll do an online consultation and provide you with the prescription for the medications as well. If you're under the care of a professional, you can also talk to them about any side effects that you might be having. Earlier in the video, I said that I would mention some other methods to battle hair loss. So let's talk about some of those. One of the most common medications people use for hair loss is minoxidil or Rogaine. This has been around for over 30 years and it's very effective, and it's especially effective when used in combination with finasteride. They're synergistic with each other, and the result at slowing hair loss and improving the quality of the hair you have is excellent with this combination. Some other adjunct treatments, I don't know if you've heard about laser treatments or photobiomodulation. This treatment actually requires you to wear a helmet or hat several times a week, and this treatment stimulates the mitochondria in the cells of your follicles, helping them to get more healthy, produce better quality hair, and slow your hair loss. Platelet-rich plasma, or PRP, is another therapy that you can consider. Basically, the platelets in your body that help you clot when you cut yourself, they have growth factors contained within them, and those growth factors have been shown to actually improve the quality of your hair. And so there's a treatment where you go into a clinic, we draw some blood, we spin it down in a centrifuge and create this platelet-rich plasma, and then that is injected back into your scalp. Some protocols require you to come back several months in a row, others maybe every 6 to 9 months. It depends on who the provider is. But anyway, the combination of those treatments will give you the best chance at treating the hair loss you have, and slowing future hair loss. So I've talked about some of the treatments for hair loss, the medical treatments, the procedural like the PRP, but there's no treatment that's going to put hair where you don't have it. We have to turn to hair restoration surgery for that, and the most common procedure we use to put hair where you don't have it is FUE, or follicular unit excision. If you want more information on that, click the description below. While we're talking about medical therapies, I do want to mention one misconception or myth about finasteride. And I hear this from patients fairly frequently, and that's because you guys are good at doing the research. Some of my patients have asked me about a connection between finasteride use and prostate cancer. Let's dive into that just a little bit. There was a study years ago called the Prostate Cancer Prevention Trial. And what that trial was looking at was to see that if finasteride, which action is to shrink the prostate gland, could also result in a lower incidence of prostate cancer. This trial was a 7-year trial, and about year 5, they did recognize that in fact it was was lowering the risk of prostate cancer. So everybody was all excited. We thought that's going to be a new treatment to prevent prostate cancer. However, when they went back and looked at the data, they noticed that there was, however, a doubling of the bad prostate cancers. Now, this concerned everybody, but when they went back and reviewed the data, it actually showed something a little bit different. So I won't get into too much detail, but at the end of the prostate cancer prevention trial, they did random biopsies in the treated group of patients and the patients that were receiving the placebo. And when they did this random biopsy, they were just sticking a needle into the prostate gland, withdrawing some cells to determine, hey, are we seeing anything in there that's bad? Well, again, what they showed was there was an increase in the bad prostate cancers. But when they looked at it in detail, what they really realized was this. In the placebo group, in other words, patients not receiving the actual drug, finasteride, their prostates were larger. And the patients that were treated with finasteride, their prostates were smaller. So if you're gonna stick a needle into a ball of tissue, obviously you're gonna get more results when you stick it into the small ball of tissue than the big one. So think of sampling a basketball versus a baseball. So what they found out is not actually that it probably increases the risk of a bad prostate cancer, it's our ability to detect the cancer increases. In other words, that's a good thing. So you shouldn't be concerned about using finasteride for an increased risk of prostate cancer, but you should always check with a urologist if you're concerned about, especially if there's a strong history of prostate cancer in your family. So we've talked about a lot of things in this video, specifically concerning finasteride, how it's developed, what it's used for, and so forth. But I think the bottom line is that finasteride is one of our mainstays of therapy for male pattern loss. It's going to help the hair you have, it's going to stabilize the hair loss, and give you the best quality you possibly can. But there's limitations with it. And the limitations are it's not going to put hair where you don't have it. If you want that, you're going to have to look towards hair restoration surgery, such as FUE, follicular unit excision. A lot of people are concerned about the side effects from the medication, but again, as we've discussed, they're relatively rare, and in most cases, if you stop the medication or change the dose, those side effects will go away. It is absolutely one of the most effective medications we have, and I certainly urge you to consider using it. Seek out a medical professional, get a consultation, get on the medications the minute you notice hair loss. I mentioned earlier that you can battle hair loss with a hair transplant. In this video, I talk about my own experience with a hair transplant.